Hello, I'm Stephanie Steiner, and today I'd like to discuss the recent updates to the Supplemental Nutrition Assistance Program, commonly known as SNAP, as introduced by the Fiscal Responsibility Act. In June 2023, the Fiscal Responsibility Act made significant updates to the Supplemental Nutrition Assistance Program. This legislation raised the age limit for work requirements from 49 to 54 by 2024 and expanded exemptions for vulnerable groups. The goal is to balance the promotion of employment with ensuring access to essential nutrition. Understanding the impact of the updated SNAP policy requires a closer look at the key stakeholders involved. SNAP recipients are at the forefront as they depend on these benefits for food security. The changes to work requirements could directly affect their ability to access essential nutrition. Policymakers, including legislators and government officials, are responsible for creating and refining SNAP policies. They must balance the needs of recipients with broader economic and social objectives. Advocacy organizations, such as Feeding America, play a crucial role in promoting expanded access to benefits and ensuring that the voices of these in need are represented. Lastly, state agencies are tasked with implementing and managing SNAP at the state level, overseeing eligibility, processing benefits, and ensuring adherence to federal guidelines. Each of these stakeholders bring a distinct perspective and interest to the table, influencing how SNAP is administered and experienced. Supporters of the updated SNAP policy argue that increasing work requirements promotes economic independence and reduces reliance on government assistance. This aligns with conservative interests focused on reducing government spending and encouraging personal responsibility. Opponents, however, worry that these requirements disproportionately impact vulnerable populations, such as those with limited job opportunities or childcare. They argue that the policy may worsen food insecurity and overlook systemic issues. This viewpoint is often supported by progressive interests advocating for stronger social safety nets and equitable access to essential services. Public reaction to these changes is divided. Supporters argue that the new requirements encourage work and self-reliance. Critics, however, are concerned that these changes may negatively impact vulnerable populations who struggle to meet the new requirements, potentially increasing food insecurity as seen in past instances of similar policy shifts. Implementation of this policy is gradual. Beginning in September 2023, work requirements apply to individuals aged 18 to 50 and will continue to extend to those up to 54 by 2024. Exemptions are in place for specific groups including pregnant individuals, those with disabilities, the homeless, veterans, and caregivers. State agencies are responsible for identifying eligible individuals for these exemptions and ensuring they are not unfairly penalized. From the perspective of a dietitian, there are concerns that the increased work requirements in the updated SNAP policy could limit access to essential nutrition, particularly for those of vulnerable populations. Adequate nutrition is crucial for health, and these changes may negatively impact individuals' well-being. For dietitians, this policy shift could mean a greater focus on addressing food insecurity in their practice, complicating their interactions with clients. They may also need to advocate more within the healthcare system to ensure equitable access to nutrition assistance programs. I recommend a thorough review or amendment to this policy. Evidence suggests that strict work requirements may not lead to substantial long-term employment and could worsen food insecurity. For example, states with stricter SNAP rules often see minimal increases in employment rates among recipients. We should explore enhanced support systems, such as job training and education, and ensure that exemptions are sufficient to protect vulnerable populations. Access to SNAP is vital for public health and community well-being. In conclusion, while the updated SNAP policy aims to encourage employment, it's crucial to weigh the potential unintended consequences. Balancing economic independence with the need to meet basic nutritional needs is essential. We must advocate for policies that not only promote self-sufficiency, but also safeguard for health and dignity of all individuals. A careful, evidence-based approach will help ensure that our most vulnerable populations are adequately supported.